I am Dr. Fernando Villamil. I'm an orthopedic spine surgeon practicing in Tulsa, Oklahoma, and today we're going to talk about a very commonly overlooked cause of back pain that is not related to discs themselves like we're mostly used to hearing, but it's a different source of back pain related to the sacroiliac joints or the SI joints. The sacroiliac joints are the two joints that connect the spine, which is right here, and ends up in the sacrum, which is the lowest part of the spine. And they connect the spine with the pelvis, which is right here. So these joints are small, they move very little under normal circumstances, but they can be a source of severe back pain under special situations such as hypermobility, which is when they move more than they're used to. The purpose of the sacroiliac joints is to transmit forces from the ground all the way up through the legs and then all the way to the spine and the rest of the body, and then with gravity from the body all the way down through the spine, they cross the sacroiliac joints or SI joints and then all the way down to the legs and the feet and then the ground. So they are small, they move very, very little, but they have a very important function in the human body. The sacroiliac joints do not move much. So when there is an excess motion of the sacroiliac joints because of different reasons, such as it could be a car accident, it could be arthritis, it could be even childbirth, falls, any situation where they can cause hypermobility or excess motion of the sacroiliac joints, that can be a source of pain. Common complaints of patients suffering from SI joint pain include lower back pain, which can be very similar to pain coming from the lower back, so the lumbar spine. Also pain going down the back of the thigh or even the buttock, very similar to sciatic nerve pain. Also instability, and patients usually have problems or pain that affects their activities of daily living, such as sitting down in a car, standing up for a prolonged period of time, picking up things from the floor. They cannot sit straight and have to sit on the side. In my practice, 1 or 2 out of 10 of patients complaining of chronic low back pain can have SI joint pain as the source of their back pain. One of the most challenging aspects of treating SI joint pain is actually diagnosing SI joint pain because it behaves very much so like low back pain coming from the lumbar spine. So history is very important, and then physical exam is also very important as well. I start by asking my patients to put their finger in the specific spot where they think where their pain is coming from. Typically it's one side, but it can be both sides at the same time. If they can put their fingers and isolate in one specific spot where they think their pain is coming from, then I move to the next step, which is a very comprehensive physical exam, which consists of a series of provocative tests where we try to replicate the symptoms of SI joint pain. If the physical exam is positive for SI joint pain, then the next step is to send the patient for diagnostic sacroiliac joint injections. That consists of a series of at least 2 injections on the specific SI joint. If the patient gets some relief from those injections, then we can consider those injections as a positive test. It is important for the patient to be aware that any relief is considered a good test. It can be 30 minutes, it can be 3 weeks, it can be a week. When treating the spine and the SI joint, we try to be as conservative as possible, meaning trying to avoid any surgical procedures. We start with conservative measures that include oral medications and anti-inflammatories. Injections, they can be diagnostic, but they can also be therapeutic, so patients can get relief from injections. Physical therapy and getting those surrounding structures around the SI joint stronger helps. The concept of physical therapy and how it works, the stronger you get those supporting structures around those joints, the less force is transmitted through the joints, and then the pain gets improved. When conservative measures fails and the patient continue to have pain, then surgery can become an alternative for the patient. In my practice, I use iFuse, which is a surgical procedure designed to fuse or immobilize the SI joint pain. So by stabilizing the joint and stopping it from moving, then the pain stops. The patented triangular shape of these implants actually allow more stability compared to other implants out there on the market. The iFuse implant is made of this special 3D printed titanium technology, and it also has this patented triangular shape which makes the implant more stable when placed in the bone. This is a minimally invasive procedure done by a small incision that is about 1 inch long. The whole procedure takes like an hour on average. Most patients get to go home the same day. Most patients can bear weight the same day, maybe with some assistance at first of a cane, crutches, or maybe a walker. When I see patients 2 or 3 weeks after the surgery, they come to the office and most patients are having very little discomfort in the surgical area. I let patients go back to most of their regular things, including driving a car, doing things in the house, doing some kitchen work. That happens 3 or 4 weeks after the surgery. There's over 100 scientific publications out there on the iFuse implant, and patient satisfaction rates are up to over 90% of results, and this is what I'm seeing in my practice. If you're having low back pain and you still haven't found the answers, I'd be delighted to see you at Spine by Villamil in Tulsa, Oklahoma, and we'll do a full workup and we'll answer your questions and see if SI joint pain is the source of your back pain.